Welcome. Before we start talking about prostate cancer, what it is, how it's detected, and how to treat it, let's start with the basics. Your prostate gland. We want to be certain we're on the same page about the prostate, where it is, and what it does. You see, all men have a prostate gland. It's a small organ and internal part of the male reproductive system. You can't normally see it or feel it, but it's there, low in the pelvis, directly below the bladder and in front of the rectum. The urethra, a narrow tube that drains urine from the bladder, goes directly through the prostate before exiting the body within the penis. You may have heard the prostate gland described as squeezing the urethra like a fist holding a string. That's why most of the symptoms associated with prostate problems have to do with urination. More on that later. Now, just above and to the sides of the prostate gland are the seminal vesicles, the only other internal part of the male reproductive system. So, what's the point of all of this plumbing? Most men know that in addition to making testosterone, testicles produce the sperm needed to conceive a child. Of course, that happens after it exits the penis with ejaculation, but there's more going on behind the scenes. Muscles in the testicles squeeze mature sperm into the tubes that carry it into the pelvis. From there, they join with liquid secretions from the prostate gland and seminal vesicles, then exit the penis in ejaculation. So, the prostate gland. A mixture of glandular tissue and muscle fibers serves two essential functions in reproduction. First, it produces prostatic fluid, a major component of semen serving both to carry the sperm and to prepare it to fertilize the egg. Second, the muscle fibers within coordinate contractions to help propel the semen out of the penis in ejaculation. This may be more than you wanted to know, but it's all going to be relevant to our discussion of prostate cancer. While your prostate gland began developing before you were born, it didn't mature until puberty. The testosterone produced in your testicles influenced the prostate gland to grow about the size of a walnut and become functional. A healthy prostate gland produces a protein called PSA. That's prostate-specific antigen, a biomarker easily measured in the blood. A detectable PSA is perfectly normal, but factors causing inflammation or growth of the prostate can cause elevations in the PSA level. You'll hear a lot about PSA levels at Fighting Cancer Network because detecting an elevated PSA is key in managing prostate cancer from diagnosis through treatment to follow-up. A man's prostate may grow through his life. This is called BPH, benign prostatic hypertrophy. BPH is not dangerous, and it has nothing to do with prostate cancer. And BPH doesn't increase your risk of prostate cancer. BPH can cause a lot of urinary discomfort, though, because pressure on the urethra causes urinary urgency while making it difficult to empty the bladder. Thankfully, there are both medications and procedures to help with this. That's why it's always important to talk openly to your doctor about these symptoms. Trust me, they've heard it all before. BPH also can cause an elevation in the PSA level because the prostate gland is enlarged. Prostatitis, an infection causing inflammation in the prostate gland, can also increase the PSA level. Men with prostatitis can have a lot of urinary urgency and are also likely to have burning with urination. Again, this doesn't have anything to do with prostate cancer, but do see your doctor for relief. Trauma from long bike rides or ejaculation itself can also cause a short-term increase in the PSA level in the blood. So that's your prostate in a nutshell. It's a small gland, but it plays a big role in a man's life.